CNA State Board Exam Practice. Welcome to the quiz. Question 1. You are working on a respiratory unit and are caring for Mrs. Margaret Sullivan, a 68-year-old female patient who was admitted yesterday with acute exacerbation of chronic obstructive pulmonary disease, COPD. She has a history of severe respiratory disease, currently requires supplemental oxygen, and has been experiencing significant shortness of breath. This morning during your rounds, you find her sitting upright in bed, leaning forward, using her accessory muscles to breathe, and reporting that she is having difficulty catching her breath. Her oxygen saturation has dropped to 88%, and she appears anxious and fearful. She is asking you repeatedly if she is going to be okay and whether she might stop breathing. In response to her respiratory distress and anxiety, which position and intervention represents the most appropriate clinical approach to support her breathing and comfort? Option A. Have her lie flat on her back in bed to allow her lungs to expand fully, and explain to her that this position will help her breathe more easily and that she should remain flat for the next several hours to recover. Option B. Place her in a semi-Fowler's or high Fowler's position with her head elevated at approximately 45 to 90 degrees. Support her with additional pillows behind her back and under her arms. Place the oxygen mask or nasal cannula as ordered, and remain present to provide reassurance while notifying the nurse about her respiratory status. Option C. Have her sit in a chair at the bedside rather than in bed. Suggest that she try to relax and calm herself, and assure her that her breathing will improve as her anxiety decreases. Option D. Encourage her to lie in a prone position facing toward the window so that she can focus on something external rather than her breathing difficulty, and dim the lights to help her relax and reduce her anxiety. The answer is B. The best position for a patient in respiratory distress is upright, semi, to high Fowler's because it allows maximum lung expansion, uses gravity to help diaphragm movement, and improves oxygenation. Option A is incorrect. Lying flat actually restricts lung expansion and can worsen shortness of breath, especially in COPD. Option C is wrong. While sitting in a chair might be upright, abruptly moving a distressed patient could be dangerous. Also, simply telling her to relax is not an intervention, and you should not leave her to get the nurse without staying with her. Option D is incorrect. Prone position is not indicated for COPD exacerbation. It restricts chest expansion and does not address the oxygen desaturation. The correct action is to position her upright, ensure oxygen delivery, stay with her for reassurance, and urgently notify the nurse. Question 2. You're attending a unit-wide in-service training about patient privacy and confidentiality in healthcare. The instructor is discussing the importance of protecting patient information and asks the group several questions about scenarios involving protected health information. In one scenario, you are asked what the primary focus of HIPAA, Health Insurance Portability and Accountability Act, is in the healthcare setting. After reviewing what you have learned about healthcare law and regulation, you need to select which statement most accurately describes the primary purpose and focus of HIPAA regulations in protecting patient rights and healthcare information. Option A. HIPAA regulations are designed primarily to protect and manage patients' financial information, such as insurance benefits, deductibles, and copay amounts, ensuring that this information is kept confidential from healthcare providers and that patients maintain control over billing decisions made by the hospital. Option B. HIPAA regulations are designed to protect patients' privacy and ensure that all protected health information, including medical history, diagnoses, treatment plans, and other confidential medical information, is kept secure and is not disclosed to unauthorized individuals without patient consent. Option C. HIPAA regulations are primarily focused on protecting the physical security of hospital buildings and preventing unauthorized individuals from entering healthcare facilities where patient care is being provided. Option D. HIPAA regulations were established to control and manage employee work schedules, vacation time, and employee privacy in healthcare settings, ensuring that healthcare facilities maintain appropriate staffing levels and that employee information is protected. The answer is B. HIPAA's main purpose is to protect the privacy and security of patients' health information. Option B correctly states that. Option A is incorrect because although HIPAA includes provisions about insurance portability, its primary focus in healthcare settings is on privacy of medical records, not just financial data. Option C is wrong. Physical security of buildings is not covered by HIPAA. Option D is wrong. Employee work schedules and privacy are not the focus of HIPAA. It is about patient information, not staff. Question 3. You are making your initial rounds to meet your assigned patients for the day. Mr. Robert Anderson, an 85-year-old male with a history of falls, is being cared for in your unit. He has been hospitalized for 3 days following a hip fracture and subsequent surgical repair. The patient has some confusion, takes multiple medications that can affect balance and mental status, and has reduced mobility due to his recent surgery. Before you assist him with any activities or transfers, you recognize that it is essential to perform a comprehensive assessment to determine his capabilities and any limitations that might affect his safety during activities. What assessment must you always perform before moving any patient or assisting them with physical activities? Option A. Check the weather outside to see if it is sunny or rainy, as this can affect the patient's mood and willingness to participate in activities, and review the hospital's daily schedule to see what activities are planned. Option B. Assess the patient's current physical and cognitive abilities, determine any limitations due to illness or surgery, understand any restrictions from physicians or nurses, and evaluate the patient's readiness and willingness to participate in the planned activity. Option C. Determine how many family members are currently visiting the patient, as their presence can motivate the patient and make them more cooperative during care activities, and find out whether the patient has eaten lunch yet. Option D. The answer is B. Before any patient handling, you must assess the patient's ability to assist, any medical restrictions, and their willingness. Option B correctly outlines this. Option A is irrelevant and unprofessional. Option C is not a primary safety assessment. Family presence and meal status do not determine safe mobility. Option D is missing in the PDF, so left blank. Question 4. You are working on an isolation unit where several patients require droplet precautions due to suspected respiratory infections. You have received training on infection control and understand the importance of preventing transmission of infectious agents to yourself, other patients, and members of the healthcare team. During your shift, you are caring for a patient who is on droplet precautions and requires assistance with oral hygiene and eating. Based on current infection control guidelines and recommendations for preventing the transmission of infectious droplet-borne pathogens such as influenza and other respiratory viruses, which of the following best describes the most important personal protective equipment and technique you should use? Option A. Wear only standard gloves on your hands without any facial protection, as the gloves will protect you from respiratory droplets, and you can wash your hands after care without removing gloves first. Option B. Wear a surgical mask or appropriate respiratory protection when you are within 3 to 6 feet of the patient, as respiratory droplets typically travel only a short distance through the air before falling to surfaces. And ensure your mask is properly fitted and covers both your nose and mouth. Option C. Wear a clear plastic face shield that covers your entire face, but does not wear a mask, as the shield will protect you from all infectious agents, and you do not need to wash your hands if you are wearing the protective equipment. Option D. Wear gloves and a gown, but no mask is necessary, and you can touch your face and other areas while wearing contaminated gloves as long as you wash your hands at the end of your shift. The answer is B. For droplet precautions, a mask is required when within 3 to 6 feet of the patient. Option B correctly describes this. Option A is wrong because gloves alone do not protect mucous membranes from droplets. Option C is wrong. A face shield without a mask does not provide the needed respiratory protection, and hand washing is still essential. Option D is wrong. A gown and gloves are part of contact precautions, but for droplet, a mask is key, and touching your face with contaminated gloves is never acceptable. Question 5. During your morning assessment rounds, you observe that Mr. Charles Watson, a 70-year-old male patient who has a urinary catheter in place, appears to be uncomfortable and anxious. When you check his catheter bag, you notice that despite the fact that the patient has had adequate fluid intake over the past 8 hours, there is no urine present in the collection bag. The tube appears to be connected properly. The patient denies pain at the catheter insertion site, but he does complain of discomfort in his lower abdomen. The catheter insertion is secure, and there is no evidence of kinks, bends, or obstruction in the tubing visible to you. Given these clinical findings and the absence of expected urinary output, which action most appropriately addresses this situation? Option A. Assume that the catheter is functioning properly and that the patient is simply not producing urine at this time. Do not report the finding, document that the patient had no output, and continue monitoring for the next few hours to see if output appears. Option B. Report this significant finding to the nurse immediately, as the absence of urine output in a catheterized patient can indicate catheter obstruction, infection, or other serious urinary complications that require prompt assessment and intervention. Option C. Increase the patient's fluid intake immediately by encouraging him to drink more water and wait 2 hours to observe if urine output appears before deciding whether to report the lack of output. Option D. Reposition the patient several times and observe for a period of 2 hours before reporting the finding, and only notify the nurse if the patient complains of increased abdominal pain or if you observe fever. The answer is B. A catheterized patient with no urine output for 8 hours despite adequate intake is an urgent situation. It could indicate a blocked catheter, which can lead to bladder distension, kidney damage, or infection. Option B is correct. Report immediately. Option A is negligent. Assuming no urine production without investigation is dangerous. Option C delays necessary intervention. Increasing fluids could worsen bladder distension if the catheter is blocked. Option D also delays reporting. Waiting 2 hours could cause harm. The nurse needs to assess and possibly irrigate or replace the catheter. Question 6. You're in a training session reviewing proper hand hygiene techniques, and the instructor is emphasizing the critical importance of appropriate hand washing in preventing healthcare-associated infections. The instructor is asking questions to assess staff understanding of proper hand hygiene practices. You are asked how long you should vigorously wash your hands using soap and running water, including cleaning under your fingernails, between your fingers, and all surfaces of both hands, in order to effectively remove microorganisms and prevent transmission of infectious agents. Option A. You should wash your hands for only 10 seconds, quickly rubbing soap over the surface of your hands before rinsing under running water. Option B. You should wash your hands for approximately 15 seconds, which is usually enough time to remove most visible dirt and some microorganisms from the surface of your skin. Option C. You should wash your hands for at least 20 seconds, using soap and warm running water while scrubbing all surfaces including under fingernails, between fingers, and the backs of your hands to effectively remove microorganisms. Option D. The answer is C. The CDC recommends washing hands with soap and water for at least 20 seconds. Option C correctly states this. Option A, 10 seconds, and Option B, 15 seconds, are insufficient to effectively remove pathogens. Option D is not provided in the PDF. Great job! Don't forget to subscribe. Bye!